Hey everyone, and welcome to today's event. I'm Yulia from UXPressia. We at UXPressia are a team of people passionate about helping others design and deliver better experiences. With our online UXPressia platform, you can build data-rich customer journey maps, make your personas come alive, and do that all together with your teammates in real time. You can also check out UXPressia Academy that has interactive courses on all things journey mapping, personas, and interviews that will help you get started in no time. And of course, don't forget about our free community events, just like this one, to share insights from fellow mappers. Today, we'll be having an interview on healthcare journeys. Our today's guest expert is Jennifer Fraser, Director of User Experience at Macadamian. Jennifer has a master's in architecture and more than 15 years of practice as a user experience designer. She has designed products for many different target markets, from creative professionals to large government agencies. For the next half an hour, we'll be talking about journey mapping in the healthcare industry, why it's important, how it's different from other industries, the role of UX research in map development, and many, many other things. After that, we'll have a Q&A session where you can pose a question and get some answers. Well, without further ado, Jennifer, hi, how are you doing today?
I'm good, thanks, Yulia. Thank you for the introduction. It's so exciting to be here and to see everybody from all over the world. That's pretty impressive. So as you mentioned, I'm the Director of User Experience at Macadamian. So in that role, I lead our team of user experience researchers, interaction designers, visual designers, and graphic designers. And our team works closely with our clients, as well as the rest of the delivery organization, to do research, design, and ultimately deliver products to our customers.
You worked for Macadamian for more than 10 years now. Can you briefly describe your current position and your responsibilities?
Sure. So as I mentioned, I head up the user experience design team. So I work really closely with the director of our product management office and the director of engineering. We are a distributed team, and we have an office in Cluj, Romania, and in Yerevan, Armenia as well. So we're a global office headquartered here in Canada. So as I mentioned, our team works really closely with all the other crafts in the organization, doing the research, design, and collaborating on the development of our products.
So what projects do you typically work on? Who are your clients? Can you tell us more about that?
Sure. So right now, I'd say about 80% of all our projects are healthcare related right now. But I realize healthcare is like a really big bucket of project types. So within healthcare, we do work across a pretty large spectrum of clients. Some of them are medical device manufacturers. We've worked with large health insurance companies. We've also worked with a bunch of different small medical startups. They might have a device, they might just have an application. So it's pretty broad range in terms of the types of healthcare customers we have. But there's also a range in terms of the kinds of services we deliver. So some clients come to us just for our user experience research services. Some clients come to us for just our design services. But then there's definitely other clients that come to us for like the full spectrum of services. So that would be like the research, the design, and the development. So we would do like the full end-to-end services for them.
All right, so I assume that you do have or might not have some experience of journey mapping for other industries, but what I would like to know, in your opinion, how is journey mapping in healthcare different from journey mapping in other industries, let's say banking or e-commerce?
Sure. So healthcare journey mapping can be different because of the complexity. So the persona that you're representing that's going through the experience represented in the journey map, they can have a really large number of touch points across their journey, especially if the persona is somebody that maybe has more than one coexisting condition. Okay, so maybe they have some comorbidities. So they might have several different specialists that they need to work with, several different devices that they need to be monitoring to get some information about how they're doing, how they're tracking. So there can just be a lot of touch points across different people, different devices, and different systems. The other thing that you need to think about when you're doing a healthcare journey map, and it can happen sometimes in banking or finances, but be thoughtful about the emotional state of the person, the persona that you're targeting. Banking and finances can also lead to a heightened emotional state in people, but with healthcare, we just really need to be cognizant of the emotional state of the person going through that journey. Have they just been diagnosed with a serious illness? Are they struggling to kind of manage a chronic condition that has them feeling like they're not even kind of particularly in charge of their own body? These are all things that we need to be thinking about when we're designing something to help people achieve their goals when they're dealing with their own health. So those are some of the differences and similarities to think about.
Okay, great. And what about the number of touch points compared to other industries? Is it different somehow, or is it the same, maybe less, more? Can you tell me about it a bit more?
For sure. I would say on average, again, it depends on the product, but generally there can be more. When you're going into the health system or considering a healthcare scenario, there could be different healthcare representatives that you're working with, from even trying to make an appointment to see the caregiver. There might be other nurse assistants or nurses that you're also seeing in addition to the actual specialist that you're meeting with. And then depending on where you live and how your healthcare coverage is handled, there's the whole after appointment dealing with payment and insurance claims, and what's your responsibility as a patient versus the clinician or the office manager. So it can get quite complicated, especially if you're dealing with a situation where you might be managing some of your own readings of the symptoms. I'm thinking if you have diabetes and you're using a glucometer to measure your levels, kind of how you share or give that information to a clinician, then they have to get the information of their system. So it's a complex ecosystem. Healthcare is an incredibly complex ecosystem. So there's a lot of different people, systems, and things to take into account when you're drawing or illustrating the map for your persona.
Okay, great. So how do you actually approach journey mapping in healthcare in general?
I'll sum it up with one word, and that's carefully, for a whole bunch of reasons. And it's also an interesting question to ask, given that we're in the midst of a global pandemic, because that's definitely had an impact on how we're able to do the research that we typically do. So I'm going to answer it in two ways. So pre-pandemic, ideally, we would go out and we would do contextual research. So we typically pair a user experience researcher with an interaction designer, and the two of them would go out and observe people representative of our persona in their kind of contextual environment. And the number of people that we might go and observe and the context within which we would observe them really depends on the project that we're working with. So just to give an example, we had a project with a customer that was focusing on helping kidney specialists, so kidney doctors. And after talking to the client, understanding the project and the needs, we realized that we needed to do kind of two sets of visits across different cities. So some of the observation was done within a dialysis clinic within a hospital, and another one was done in a dialysis clinic in a clinic outside of the hospital settings. And it was valuable that we did that because there was enough differences in terms of the work being done that we did end up creating two different journey maps. One for the journey map within the context of the hospital, and the other within the context of the standalone clinic outside of the hospital setting. So ideally, we go out and we do the observation, gather the information, analyze it, and then the researcher and the designer then collaborate into kind of distilling that information, extracting the insights, and visualizing that information into both a journey map and a report that would accompany it for our client. Now that's kind of typical. There are situations where our clients have asked to also participate in it. So there are situations where we've had representatives from the client come with us and observe the doctor in the context of their work. And then we would have, once we've done a series of the observations, we would then meet with them and do like a co-creation session with them, where we would co-create the journey map with them, like a working version of it, that we would then kind of turn into a final artifact for them. But now it's a little more challenging to get permission to both recruit within healthcare, but also to get permission to go on site. So we haven't had any journey mapping projects since pandemic has started, but we'll be needing to work through how we can handle the logistics of getting that rich information without necessarily being able to be on site following a doctor around within a hospital setting.
So did you get a chance to revisit the previous journey maps you had, and maybe you noticed how to change them now, or maybe you did notice some changes in how you approach the emotional state of patients currently compared to what it has been before?
So some aspects of the maps would definitely change because a lot of prep work or initial appointments that were happening face-to-face within a clinic are now being done like this, remotely. So that is definitely, that would definitely be reflected in a map. And also I think since so much is being done through teleconferencing, remote, it also does in some situations, it can lead to a heightened emotional state for some people, because there's some people that are kind of struggling to figure out how to install these things and get them working. We internally went through a journey mapping exercise that was about somebody trying to set up their iPad to do a remote session with their doctor. And there's a lot of new anxieties that are introduced because of possibly a lack of comfort with the system or the technology. You're already not feeling well, right? You're making an appointment to talk to the doctor for a reason. And there's an additional sense of concerns around security and privacy. You know, where's this information going? How's it being used? Who can see it? When you're no longer have that sense of privacy, when you're going into a closed clinic environment with your healthcare professional. So there are a lot of changes in multiple levels given the current situation we're in.
Yeah, I can imagine people aren't really comfortable going to the doctor in the first place, and now that they have to do it online, this is another struggle, especially for those who are not really tech savvy. I can imagine it can be a struggle. So what does your team look like? I bet it is a team effort. It's not a one-person thing to do. Who is involved in the whole process? Designers, researchers, maybe some clinicians who give you some advice?
Yeah, so it can vary depending on the project. But as I mentioned, typically it's a user experience researcher and an interaction designer working as a pair that would go out and do the contextual research. Before we even get to that point, we typically would go through a discovery session with the client, just really understanding what it is, what their goals are, what they're trying to achieve, what research questions they have that we're trying to answer. That's kind of leading up to why we've decided to do even a journey map in the first place. And then we'll work really iteratively with them coming up with our research protocol that the user experience researcher will write out, that's really documenting how we're going to approach the session and what are the questions that we're going to ask while we're there observing the clinician as they're going about their work. So that then gets repeated across the different participants. As I mentioned, it could be in different contexts. And then that information is then worked through by both the user experience researcher and the interaction designer. Part of the reason we pair those two roles together to actually conduct the research is because they're coming at things from different perspectives. So they can kind of see different things through different lenses as they're observing the healthcare professional or the patient going about their business. So they're giving different perspectives on things. Then as we're working through the information again, we'll be sharing parts of that back out to the client. And then we could, as I mentioned, collaboratively co-create that journey map with them, if that makes sense. Or other times we'll just create it on our own and share it back with them iteratively, get feedback, making sure it's meeting their expectations and is representing the findings of our research.
So since healthcare is a very sensitive topic, is there anything that should be done differently for healthcare projects when doing the research itself?
Yes. It goes back to my comment about being careful. One thing we need to be really aware of is getting really clear consent from the people that we're observing. There's privacy laws, there's sensitivity to health information. It means that us as researchers really need to use a lot of caution with our work and with our processes. So you need to get really clear consent from people. And it needs to be from both, if you're going in to say, observe a clinician, you need to get consent from the clinician, but also any of the patients they might be interacting with or any other healthcare worker that you'll be observing. So it's really of critical importance to get that consent. Now, in terms of the methods we use while we're there, as I mentioned, we do ethnographic observation. Depending on the project, we might do interviews. We might do diary studies. So the method we use can vary depending on the project, but regardless of the method, getting that clear consent is of utmost importance, especially on healthcare projects. I mean, ideally for all projects we're working on, we're getting clear consent from our research participants, but especially within the domain of healthcare.
So since you have such a vast experience with research, could you probably share some examples of insights that your research has brought to you? And was there something that turned out to be surprising and completely unexpected before you started doing it?
So there's one small story that I like. It was from that example with the kidney specialists. And they were observing them. And so they're going in and doing rounds with different patients that were on dialysis. And the kidney specialist went in and they couldn't figure out what the kidney specialist was doing. They would approach the system, they would kind of do some things, but they hadn't observed this with other kidney specialists. So after observing them for a while, when it came to the point where they could take them aside and ask them questions, they asked the doctor what they were doing. And it turns out they're actually just going over to the system to look up the patient's name. Because on the displays that were available to them, it wasn't easy for the doctor to see the patient's name. So they're going over to change some things so they could get the name, because for them, it was really, really important that they address the patient by their name. So that was the way that they wanted to start all of their interactions with the patients. So that's something that you wouldn't think about or see as being a kind of a high priority thing, because it had nothing to do with, the patient being on the dialysis or how things are going, but it was just one of those things. If you weren't there watching them, you wouldn't have been aware how important it was and how critical that is to creating that relationship or engagement or encounter between the clinician and the patient. So it's things like that I think help really show the power of getting out and actually observing people working within their work environment. We also have, there's another story where a company came to us and they were looking at creating a viewer for cancer specialists to view content on an iPad. So we went out and the researchers met with a bunch of different oncologists and observed them working. At that point, we actually did have a concept, like a little prototype that we could share with them after the observation to get their feedback on. And the feedback came back really strongly that the oncologists were never going to use that product. For a whole bunch of reasons, they weren't going to use that type of viewer on an iPad. So researchers kind of bundled up all the findings, took them back to the client, and the client had done their due diligence. They thought that there was a clear need for it, but once we'd done that primary research, turned out for a whole bunch of reasons it just did not fit into their workflow. So I worked with the client and they actually ended up pivoting their whole product direction and ended up creating something completely different that was a need that had been uncovered in the research. So it's just so critical, regardless of like the market research or the secondary research you've done, to just really get out there and do the primary research and confirm that there is actually a need for the product that's being created.
Great. So based on your experience, I know it depends on the project, but what are the most important stages of customer journeys in healthcare? And why do you think they are the most important ones?
Yes, I know it depends. I think, because it's a tough question to answer, to your point, Yulia, depending on the product. But I think sometimes it could be during the retention phase. So kind of in the tail end of the journey. And that's within the context of if the product relates to some kind of behavior change or trying to establish some new good habit. So maybe for somebody with diabetes, maybe it's a dietary change, or maybe it's trying to get them to go for a walk every day. So something like that, it takes a lot of time to build up that new habit, and the amount of time it takes varies highly depending on the person and how they're being motivated, their context, who around them is supporting them or not supporting them. So there's a lot that can go into understanding their challenges and their needs and how to best support them throughout that retention phase. So that part of the journey can be really critical to understand. And then the other extreme, I was also thinking about, talked about it a bit earlier, but during the onboarding, right? As we mentioned right now, so many services are abruptly shifting to being delivered online through teleconference or video conference. So we have a whole spectrum of people that are now trying to figure out how to use this technology to meet with doctors and healthcare workers, and that onboarding process for how they get connected and get set up, how to do that in a way that leaves them feeling safe and secure is really critical. So I think that onboarding part, as well as kind kind of retention part when it comes to behavior change or kind of longer term modifications, then both those are really critical to think about.
So as you mentioned, in the whole process, multiple characters, multiple personas are involved. First being patient, the second one being provider. Sometimes it's maybe some family of a patient. So the healthcare journey map is complex on its own. So how do you capture both patient provider perspective within the same map, or maybe you do build separate maps for them?
Yeah, it really depends on the goal for the illustration. So what are we trying to articulate through that journey map? And that can play into whether or not we do show multiple perspectives. We have done some in the past that have shown both the experience of the patient and the provider, because by doing that, sometimes you can see opportunities where they both have a really coinciding low point. So you realize, okay, if we could do something to improve that low point for both of them, it's impacting both of their experiences in a positive way. Or the other thing to consider is an opportunity where they both have a high point in their experience. Maybe something can be done to make that high point even higher, that would have a positive boost to both of their experience. So it's helpful to see some of those intersections between them to understand what possible opportunities, but it really does depend on the goal behind that visualization and the story you're trying to tell with that journey map.
So we are talking about personas now here, like the representative of the patient or provider. So how do you come up with who are you building it for? Is it based on research? Do you make assumptions? How does the process go?
Yeah, so ideally it's based on research. Defining the persona is the critical first step, because you need to figure out who the persona is to then figure out what their journey is going to be. We've talked a lot about the ethnographic research. So typically as a part of that research, when we're going out observing people, one of the outputs from that research would be persona creation. So we kind of bucket the information we've received into, okay, these are the main personas that we see based on how they're working. And then we would create their journey maps if they're different. One distinction we do have, and I realize not everybody can go out and do ethnographic research. So sometimes we do create what we call, I'm going to use air quotes, provisional personas or a provisional journey map. And we label them as such to distinguish that they're not based on our primary research, that they're provisional because they're based on secondary research or information from subject matter experts. So sometimes we just can't get access to people or the locations that we need to. So in that situation, we probably have a co-creation session where we'd get different subject matter experts into a virtual room and rely on them to help create, okay, what is the typical persona for this role? And then we would co-create what their journey would be like. So when we can't do that firsthand primary research, we still do create it based on the information we have access to, but we just label it in a different way to make it clear that it's not based on our own primary research.
Okay, and I guess the last question from my side before we move on to the Q&A session, which we announced in the chat. So guys, if you have any questions for Jennifer that haven't been answered before, please feel free to put them in chat. So what's your advice for those who are thinking about building their first healthcare journey map? Because as you mentioned, this is a very complex system, and I guess a lot of folks are quite scared to begin with it.
Well, I mean, I guess in an ideal world, apprentice with somebody that has experience. because it is complex. So if you have the opportunity to work with somebody, to observe them and see how they go through the research and the creation process before trying to do it on your own. The other thing to really think about if you're doing it for the first time, again, is consent, and just be really careful about getting consent for the research that you're doing, and consider the fact that people can be especially vulnerable, and it's our responsibility as researchers and designers to treat them and their information with the utmost respect. Now, if you're in a situation where it's not possible to apprentice, I mean, there's a lot of examples out there, a lot of templates available to help you kind of break it down and just be fluid with it. It's an iterative process. One way to start is to just think about what are the main phases of the experience the person's going through. So I typically find that is kind of the easiest way to start, is like going through those columns. What are the main phases of the journey? And then working from there, kind of going through the layers of the map itself in terms of, okay, what is the person doing in those different phases? And once you start getting some of those post-its, whether they're physical post-its or digital post-its up there, it becomes a less intimidating, and just know that you're going to iterate on it a few times, and that's the goal. That's one of the most important things about doing a journey map, is making the invisible visible, right? So once it's visible, once you have the illustration, then you can start working with it, understanding the information that it's telling you. So it's just really important to just get it out of your head and onto kind of that digital page.
Okay, Jennifer, thank you so much. We've had quite a few questions already prepared for you in chat. So let's start with the first one. So how do you know that which one that you will improve exactly if users don't tell you what they want?
Where the opportunities are for improvement?
Yeah, I think, yeah, you can clarify
the
question.
Yeah, it's important to never ask people what they want. I mean, they can tell you what they want, but what they say they want and what they actually want are two different things. And it can be quite telling when you're observing somebody where they're getting frustrated. Depending on the situation, the context, we can ask the person to try and think aloud, so we can hear what's going on in their head. But research has shown time and time again that if you ask people how they go about doing something and then watch them do it, it's very, very different. So in terms of opportunities for improvement, is after observing different participants going through it, it's pretty quickly you can start to see patterns in terms of where there's friction in the experience that can be improved upon, even if they might not even be aware that it's a point of friction, because they can get so habituated to doing things in certain ways. It's only through observing them do you see how challenging it is, or how many places they have to go to get the information that they need.
Great, thank you. So the next question is from Jake, and Jake asks, are you able to share a visual example of a map?
Ooh, yes, I believe not literally right now, but yeah, I think there have some links to some of the case studies that I've shared with you before, Yulia, so I could share those after the session.
Let me pitch in probably for a second, just to give, I guess, Jake a quick overview what a journey map actually looks like, I guess. This is the template that was shared by our friend from Patient Journey Lab, Ilonka Kunrad. So this is how it looks like. This is the template for journey mapping for healthcare, which will be available soon. But this is basically how it looks. So you have different stages here and the emotional state of a patient. So yeah, but I guess Jennifer, can people reach out to you for maybe some more examples after that?
Yeah, absolutely.
Okay. Okay, great. Thank you. So the next question is, how far can one go with only a secondary research when creating personas and journey maps, niche financial market, hard to reach users? Isn't this something that applies to healthcare as well?
Yeah. Yeah, sometimes entire projects can be done using only secondary research. For different reasons, sometimes you just can't get access to do the primary research yourself. So you can absolutely create personas and journey maps based on the secondary information that you have. It's really important to leverage whatever subject matter experts you can find. So I'm thinking with one of our projects right now, the specialists that we're working with, there's some people that used to be in that highly specialized role that are now working within the company. So they're acting as proxy for us to those highly skilled medical professionals. But it's just, the question is just being aware of the risks with that, because you're not able to go out and actually validate it kind of in the field. So just acknowledging that you're doing the best you can with information you have, but there is some risk. So that's when things like usability testing or that type of other research techniques would be incredibly helpful to validate the assumptions and the decisions that you've made based on the persona and the journey map, to just make sure that you've made the correct informed decisions.
Okay, the next question is from Vic. I do find there are many edge case journeys in the health sector. How do you strike the balance in CGM covering both main and many side edge cases?
That's a really, it's a difficult balance in any project or any product. I noticed that up above in the chat, Roxana posted a link to an article that she and I wrote about ethics in digital health and product development. And part of what we talk about is just notions around inclusivity in recruitment, and inclusivity in terms of recruiting for participants, but also I feel like a bit of a broken record, but also with the subject matter experts, so that you're making sure you're getting a broad range of inputs for your design decisions. And by doing it across different participants, possibly in different cities or locations, depending on who your client is targeting, then you can pretty quickly start to see patterns of commonality. But then when you do see the outliers, it's a question of understanding or weighing the pros and cons of acknowledging that you're not going to fix that thing, and understanding the risks associated with it, and just identifying it, but saying, okay, that was in the situation, the majority are here, and so this is what we're going to focus on moving forward. But it's always a tough balance. I don't have a simple solution to that one.
Yeah, there is no magical pill to solve the matter,
Unfortunately, no.
Yeah, so the next question is, do you have any recommendations for virtual journey mapping tools that are collaborative? Let me pitch in again. UXPressia actually is a collaborative tool that a lot of people these days are using and collaborating on it while being remote as well. And as mentioned, we have lots of different templates for different types of journey maps, finance, well-being, healthcare, and everything else. So feel free to check it out. But Jennifer, what about you? What do you use?
Well, I was just going to say that UXPressia does have a lot of tools available for people, and a lot of really clear templates as a starting point that definitely helps ease you into the process. But again, there's so many options. So there's I mean, I'm not going to advocate for any particular platform, but different clients have used Mural, have used a Miro board. So yeah, there's a lot of different tools available out there to kind of, because that is really key. To your point, is just having multiple perspectives and multiple people working together on it. That's the key part of it, is that collaboration and that multifaceted perspective on what you're creating. That's the critical part of it.
So unfortunately, no sticky notes, right?
No, not right now.
Yeah, this is something a lot of people use, but remotely, kind of difficult to do that. The next question is, are there any universal blocks you've discovered unique to healthcare?
Depending on where the product is being focused, specifically in the United States, their whole health insurance system is incredibly confusing and baroque and complicated. So that is definitely an ongoing challenge for both patients and providers, because patients are constantly confused about what's covered under what plan. Can I use a generic drug? Do I have to use a brand? So it's another level of complexity when they're already dealing possibly with a really challenging situation. And then for the healthcare providers, they need to make sure all the billing codes get properly into the system so that they can get paid and their health insurance companies can get paid. And it's a very, it's a mess. Apologies to those of you who live in the States. But we found that that's definitely a universal challenge in the States, is just dealing with the health insurance system. And I think aside from that, I did touch on it briefly. I don't know if this is much of a block, but just, again, being really aware and cognizant of the emotional state of the person using the application, what kind of stresses they might be under, and how that could affect the information that you're presenting to them through the product that you're creating.
Okay, I guess our last question for today will be by Diana, and she asks, in wanting to leverage more analytics and automation tools, how does one go about perhaps encouraging those non-tech savvy personas to start embarking on utilizing more online platform versus paper? For example, an online registration form done online versus a paper online registration and faxing it in for processing.
Yeah, I think part of the friction in that scenario is actually the system itself, that it's the system in the background that's requiring the faxing being done, the form being printed out. Unfortunately, there's a lot of legacy systems in healthcare that still require things to be done in a very manual way. But how to encourage people to do more things digitally is just make it easy for them. Let's be really, when we are designing online forms, just be really mindful about what forms, what fields do you actually need them to fill out in the form. Instead of just taking that paper form that's been like that for the last 20 years, actually redesign it and be really sure that the information you're asking them is all required. And can you do it in a more kind of dynamic way, or a more progressive way in terms of, okay, what information do you need just at that beginning, the very first stage? Okay, can I ask them these other questions maybe the second time or the third time they come in, instead of having people kind of being overwhelmed with just this constant, endless series of fields before they're allowed to kind of continue through the process. So just design it well, I guess, in summary.
I guess this is kind of universal advice for any digital project you're starting to work on. Okay, great. So it seems our 45 minutes have come to an end. Jennifer, thank you so much for answering all the questions today. It was very interesting and insightful. I'm sure that all of our participants today found some answers to the questions that they might have had and got some insights as well.
Jennifer is one of the contributors to our Healthcare Journey Mapping white paper, so make sure to check it out along with our other resources we've got for you through the link in the description. Stay tuned for even more events, and I will see you around.